got some people still filtering in. Parking's always an issue on our campus, but we're going to get started anyway. I am Town Supervisor Dave Seeley. Welcome to Irondequoit Town Hall. For those of you who are not from Irondequoit, I hope you enjoy your stay here. I'd like to welcome you and thank you for attending today's Medicare Forum, sponsored by New York State Assembly Majority Leader Joseph Morelli. I'd like to thank the Majority Leader also I'd like to thank his staff who's out there and you probably met on the way in for organizing this event. This is one of three. This is a relatively new service provided by the office, and it takes a lot of work and organization, so make sure you thank them on the way out. Unfortunately, Joe had a personal matter that finds him out of town today. He sends his regards. He always likes being at these events. But his office is here, and they're ready to assist you in any way. But, of course, we have our wonderful guests as well who will be quarterbacking much of this. The Medicare open enrollment process is, I guess you could call it complex for lack of better words. And it's probably more exacerbated by that, what we see in D.C. going on with the unknown future of health care. And it's very hard to distill it and diffuse it down to our individual lives, our individual pocketbooks, and the decisions we make at the kitchen table. I remember I used to work for Joe. Joe and I spent a lot of time together. We traveled back and forth to Albany. And several years ago, his wonderful mother, Julie, had some questions. And Julie Morelli is somebody who is meticulous in detail and was really weighing her decisions in the open enrollment process. And she had some questions for her son, the state assemblyman. And I remember her son, who had spent all this time in Albany and all this time in government, really couldn't answer a lot of the questions because it is complex and it does require a lot of information. So that was one of the inspirations for these forums, and we're grateful because as you make these decisions in the open enrollment process, education and information really is your biggest ally. You can have all that chaos in D.C., but when we get to the local level and you make your individual decisions, you have stakeholders, you have organizations, and good insurers like the folks you'll hear from today to guide you through that process. So it's my hope this forum will help you be better informed consumers. I think it's noble of you to be here today and responsible for you. And with that, it is my pleasure to welcome Arlie Campbell-Rosling from the Office of Majority Leader Morelli. Arlie is Joe's Deputy Director of Constituent Services. Thank you, and welcome, Arlie.
Good morning, everyone. My name is Arlie Rosling. I work on Joe's Constituent Services team, and on behalf of Joe and our entire team, thank you for coming out this morning. It's so great to see so many faces here ready to learn about the Medicare process. Oh, I'm sorry. Is that a little better? I forgot my own advice, which was to speak into the microphone. As the supervisor said, unfortunately, Joe couldn't be here this morning. He did have a family emergency. But we are very pleased that we have the opportunity to provide another forum with you all this morning to discuss Medicare and the process of enrollment. I would like to thank our representatives here today, Mr. Ron Brandwein from Lifespan, as well as Paul Richardson from MVP, Scott Ritchie from Excelis, and Maritza Santa Ruiz from Aetna for being with us today to lend their expertise and help explain this complex and important process. I would also like to thank our sign language interpreters, Barbara McLeod and Nancy Nelson. If any of you do need their services, currently they are right out in the lobby. With so much of the population relying on Medicare health coverage, it is vital that those enrolling have all the information that they need in order to navigate this process. The Medicare open enrollment period, as I'm sure you all know, began on October 15th and will end on December 7th of this year. We hope that the information you find here today will be helpful for you in that process. As a disclaimer, I do want to let you all know that we are not selling Medicare coverage here today. This forum is purely informational and designed to give you peace of mind when you do decide to purchase a plan. Again, thank you for joining us today. Now I'd like to turn it over to Mr. Ron Brandwein from Lifespan.
The reps from the different companies will be back later to answer specific questions about their plans. They're not abandoning you. Okay? They will be back as soon as I'm done, and then you can pepper them with all sorts of questions about their specific plans, okay? So, my name is Ron Brandwine. It's up there. It's also in your packages. In your package in front of you that was on your seat, if you open it up on the right-hand side, should be a copy of the presentation. And I just opened it up myself. Does anyone have one that says something other than Medicare updates? Okay, overview. Okay. So, overview is what you should have. No, that's on. This is what I'm talking about. It says Lifespan Medicare Overview, just like it says up there. Hopefully you got that. Okay, so I also have a disclaimer. Again, I'm not here to sell insurance. I represent Monroe County Office of Aging that has contracted with Lifespan to run a program called HICAP. HIICAP stands for Health Insurance Information Counseling Assistance Program. It is exactly what it says, something that offers counseling and assistance with Medicare issues. Okay? It's a federally funded program. In every state, the State Office of Aging has that. And in New York State, the funding is spread around to every county. And in Monroe County, instead of running the program with their own people, they've asked Lifespan to run it because of Lifespan's status in the community with older adults. So I am a Lifespan representative, but I'm also representing Monroe County Office of Aging by presenting this program. What am I going to cover? I'm going to cover Part A of Medicare, Part B of Medicare, the 3 different additional insurances a person is allowed to have with Medicare called Medigap supplements, Part C Advantage plans, and Part D prescription drugs. I will explain how they each work, how you can purchase them, what they cover, what they cost. And at the end, I'll talk a little bit about what programs are available for those with low income who need assistance financially to pay for their Medicare costs. So how do these plans differ? Okay? Original Medicare is Parts A and B. That's what you get from the government. Okay? That's what you get from the government. They send you a card, and it says you have Medicare Parts A and B. A is hospital, B is outpatient. That's what the government gives you. These other insurances, Medigap Supplement, Medicare Advantage, and prescription drug coverage, they're all sold to you by private insurance companies. Okay? They don't come to you from the government. All right? The government oversees what they are offering and how they offer it and make sure they comply with all the rules and regulations, but the insurance is directly coming from a private insurance company that may be financially supported by the government in some way, but the insurance is not through the government, okay? Original Medicare, Parts A and B. Part A, Everybody usually gets Part A. Almost everybody gets it without having to pay anything extra for it. No monthly premium. The way you earn Part A is having worked and paid into Social Security. A small percentage of what you paid into Social Security goes into the Medicare fund. So if you work, you earn 4 credits a year. And if you work 10 years, you've earned 40 credits, and that's what you need to get Medicare Part A for free. Okay? If you are married, if you haven't worked but your spouse has worked for those 40 credits, you get the same benefit due to your spouse. So either you or your spouse has to have the full 40 credits, and then you get Part A for free. Part B is not free. Part B comes at a monthly premium, and we'll be discussing that later. Part A covers you if you're admitted to the hospital as inpatient status. There's a big difference. Inpatient status is not the same as observation status or emergency room status. Okay? Part A of Medicare only covers you if you are admitted inpatient status. The other services, observation, emergency room, or other services that you just go in and go out, they're covered by Medicare, but under Part B as outpatient services. The difference being, what is your share of the cost? There's a difference between Part A and Part B. Okay? And Part B does not cover normal vision, dental, or hearing care. And it does not cover your prescription drugs. If you're admitted inpatient to the hospital, while you're inpatient, whatever prescriptions you need are covered as a total package of your Part A. But if you're in observation or the emergency room and you need prescriptions, they're not covered because you're not under A. You're under B. So you need to have Part D along with Part B. And Part D is optional. It's not mandatory and it's not automatic. So everybody has to make sure for themselves that they have it. Under Part A, what is the benefit under Part A? The benefit under Part A is if you are admitted to a hospital, inpatient, your Part A benefit will cover you for up to 60 days for that event. The materials you need are on the chair, sir. Everything you need is on your chair. It's okay. Better late than never. So, 60 days of coverage with your Part A. You, the individual, would be responsible for the deductible for that event, which this year is $1,316. Next year, it is estimated that it will go up to $1,352. The red numbers are estimates because the official numbers have not been released from Washington, D.C. yet. They should be announced any day now. They should have been announced 2 weeks ago, but we're still waiting. But this is a calculation based on all the data that we know about how they calculate this number, and this is a very good estimate. If a person with Medicare is admitted to the hospital and doesn't spend 60 days there and is discharged, if that person comes back to the hospital before 60 more days elapse, re-entered to a hospital, under Medicare, Medicare will not charge a second deductible. You will, if you were in the hospital the first time for 10 days, when you come back, if you're back before 60 more days, you're in under day 11 of your 60 that you're allowed. You have to keep that in mind, because if you choose to go with an Advantage plan, Part C, they may not have the same rule. Okay? They are not required to have that same rule. But if you have original Medicare and not have an Advantage plan, that's the rule. And if you're there for more than 60 days, which is highly unlikely, Medicare will pay a large percentage, about 75% of the cost, but you would have to pay an additional co-insurance of $329 this year. Next year we estimate $338 per day for days 61 through 90, which is approximately 25% of the cost. And then Medicare even gives you additional days beyond the 90. But these additional days are called lifetime reserve days. These lifetime reserve days are credited to your account once when you join Medicare. If you happen to need to use any of them by going more than 90 days in a row in a hospital, they're subtracted from your Medicare account. And those 60 lifetime reserve days are never replenished. They're one-time use days. If you should ever have to need them, they're there this year at $658 a day, next year at an estimated $676 a day. Again, that's an estimate of what an average cost of a day in the hospital would be, and that would be 50%. Okay. I don't expect you'll need the co-insurance days or the lifetime reserve days, but it is very likely, if you have a hospital stay, that you may need, after the hospital stay, to go to a skilled nursing facility for the purposes of rehabilitation. Rehab in a nursing home can be paid for by Medicare. You have to meet certain criteria. The criteria that you have to meet for Medicare to pay for your rehab in a nursing home are, one, you have to first have been admitted to the hospital prior. You have to be admitted inpatient status, and you have to remain inpatient status for a minimum of 3 consecutive days. If you've met that condition and you're discharged with doctor's orders that say you need rehab as a result of your hospital stay, then Medicare will pay for your rehab. The first 20 days in full. After that, up to 100 days, with the individual being responsible this year for $161 a day for days 21 through 100. Next year, estimated at $169 a day. Full cost for rehab in a nursing home is up around $600 a day, so it's still very well supported, okay? But if you need more than 100 days, Medicare doesn't extend beyond 100 days. If you need to go to the nursing home without having met the 3-day inpatient stay, Medicare doesn't pay. And yesterday I was asked, well, who pays? You do. You sign in and say, I'm going to pay if Medicare doesn't, and Medicare won't unless you met the criteria. So either you pay, or if you've had the foresight and arranged for long-term care insurance, the long-term care insurance could pay. And if you don't have long-term care insurance and you don't have the finances to pay, you have to apply for Medicaid. Medicaid is the government program for those who can't afford to pay for their health care. Okay? Any questions on this? Okay, Medicare Part B. Now, I said most people get Part A for free because they have the 40 credits. Part B does not come for free. Most people have to pay for Part B. It's a monthly premium. But all people are not paying the same amount right now for Part B, because there is a connection between what a person pays for Part B and what they receive each year in a cost of living increase in Social Security, the COLA. There is a rule on the books that says if the Medicare rate goes up, as it did from 2015, and it was 105, and in 2016 it went to 121. When that happens, if there is not a sufficient amount of COLA to cover that increase, the individual is, the term used is held harmless or protected against having a reduction in their net monthly paycheck. That will not happen. So if there was, in 2016, there was no COLA at all for anybody. So everyone who was in the program and went into 2016, the new rate was 121.80, but they were kept at 104.90. Only those who joined in 2016 were asked to pay the 121.80. Then we moved into 2017, the current year, and the Medicare rate, the base rate, went up to $134. When we came into 2017, though, there was a small COLA of 0.3%, which meant $3 per 1,000 that you had been receiving, or $4.50 per 1,500. $6 if you were getting as much as $2,000 a month. That little bit of increase was not enough if you added on to either the 105 or the 122 to bring you up to the 134. So people are paying different amounts now because they got their increase on one hand, but it was taken away or applied to the higher rate in the other. So they stayed right where they were in terms of what they were getting. What we expect to happen in 2018 is that we know there's going to be a 2% COLA. That was announced. That's official. 2% COLA means if you're earning $1,500 a month, currently you'll get a $30 increase. Well, that $30 increase will be more than enough to get you up to the 134, which is expected to be the same. So you're not going to get anywhere near that full $30 increase in your check. A lot of it will be used towards going to the higher rate, but you may see a few dollars, okay? And most people should be up to the 134 for next year, and hopefully every year after that, the COLA will offset, okay? But that's what you can expect going into 2018. Now, these rates, these base rates for monthly premium, those are the rates for individuals who earn less than $85,000 a year, or married couples who earn less than $170,000 a year. Okay? If your income is, if you're lucky enough to have income that is higher than those base rates, you will have to pay a surcharge on your Medicare. Okay? But I think you'll agree with me that if your income is above that, you could probably afford to pay the surcharge. We don't worry about that. Okay. Once a person on Medicare is on Social Security, that monthly premium is automatically taken out of your monthly check. There may be some people who are on Medicare, are eligible for Social Security, but they're between the 62, 65, and 70, and they've deferred to collect their Social Security. Those people will be billed quarterly by Medicare, by Social Security to pay for their Medicare, okay? So you have your Medicare, you have your A and B, and you're going to the doctor. That's a Part B expense. If all you have is Medicare and no other insurances, you're still not going to be covered until you spend an amount equal to the annual Part B deductible. That's $183. This year, expected to be the same next year. But most people have additional coverage, either Medigap or Medicare Advantage. And with that deductible is usually covered, so you don't have to worry about it, okay? Is there anybody in this room that is on straight Medicare with no other coverage on top of it whatsoever? Good, okay. So you don't have to worry about that $183. Let's just go on from there. If a person had to meet it and then met it, then after that, Medicare covers 80%, and the person has to pay the other 20% as co-insurance. Yes, ma'am.
I don't understand the annual deductible term. I do have supplemental insurance after Part A and B.
Then it's covering it.
Okay, but what does that annual deductible 183 mean?
It means that if you didn't have that supplement insurance, you would have to pay $183 towards your Medicare Part B care before Medicare would cover the 80% for the rest of the year.
The rest of the 183.
Yeah.
Okay, thank you.
Sure. That's what we're here for, to help you understand what the benefits of Medicare are all about. Okay, so now we've got A and we've got B. By the way, this book, everybody on Medicare should have one. If you don't know, you should have gotten this. If you don't have one, I have extras here. This tells you exactly what's covered under A and B and what's not, okay? This is like your policy for the year, okay? And you will not find in there things like dental care, eyeglasses, hearing aids. They're not Medicare covered, okay? Okay. So, on top of your Medicare, you can add one of three different types of insurances. One of those is called Medigap Supplement Insurance. It used to be called supplemental insurance, but that's when it was the only additional insurance that you could add. So it was the only thing that was supplemental. Now you got the Part C's and the Part D's. So they're all supplemental if you use the Webster Dictionary definition of supplemental. So the term Medigap is the preferred term for this type of insurance. What does Medigap supplement insurance do? It picks up where Medicare left off in terms of paying your bills. With only Medicare, you would have had the deductible and the copays that we just talked about. If you add Medigap to your Medicare, you can wipe out those copays and deductibles. The insurance will cover it, but you have to pay for the insurance. The insurance usually runs about $200 or more per month per person. So it's not for everybody, but it's there, okay? And we're going to talk about what's available and how it works and what it costs. The government standardizes what's Medigap policies. They do that so that you can compare a similar policy from company to company that's offering these policies and know that you're comparing apples to apples all the time. They give you 10 different policies and they letter them. And A through N, a couple of the letters are there's only 10, A, B, C, D, F, G, K, L, M, and N. And I'm going to borrow this, if you don't mind. If you go into your packages, on the left side, there's an inner folder on the left side. Inner folder looks like this. And if you open up the inner folder, right on the front, hopefully, should be a sheet of paper that gives you all the Medigap supplement options. A, B, C, D, F, G, K, L, M, and N. The A policy is the minimum coverage. The F policy is the maximum coverage. All the other options are somewhat less than the maximum, but more than the minimum. But these are the options that the government allows insurance companies to sell. It has to be one of these options. It cannot be a combination or a variation. And when they offer a certain lettered policy, like an F policy, they must provide all the exact same benefits listed on this sheet, nothing more and nothing less. So if you're comparing an F-lettered policy from one company to another, you're comparing the exact same benefits. Okay? Yes, sir.
The other page, I mean.
Yeah, I'm about to get to the next page. If you turn that over, these are the prices currently listed on the New York State Department of Finance website. The website is given to you at the bottom if you ever want to go and check. These are the current rates for the various policies that the companies that are allowed to offer them here in New York State are offering. Okay? There's about 8 to 10 companies. I just quickly looked at it. 9. And if you pick a specific letter and go down the 9 companies, you'll see that it's not the same price. It's not the same price. It's the same coverage, but it's not the same price. I'm sure you all are used to going comparison shopping between Tops and Wegmans and Aldi's and Price Right and whatever else, and you see the same product at different prices. That's what you got here. You got it on one sheet. Question?
Going back to parts,
You have to talk up.
going back to parts A and B. When you said that 183 deductible is if you paid out more in bills,
No, I did not say that.
oh, no.
I
Okay.
said the 183 deductible is your expense if you don't have any other coverage, and if you don't, you have to spend that amount of money before Medicare starts to pay their 80%.
Okay, so, okay. You have to spend at least $183 before Medicare will pay 80%. So if you have no other coverage except A and B.
You will pay the first $183 for your doctor's visit.
Right, and then,
And then after that, Medicare will pay 80% of any additional bill.
and you pay 20.
Yes, ma'am. But if you have this F-lettered plan, you won't pay the 183, and you won't pay the 20% because that's what you're paying insurance for.
Right, but the, yeah,
have to determine for yourself whether it's worth it or not, is the point you're getting at. Absolutely. It is not worth it for everybody. But if you're a cancer survivor and you have to take cancer drugs that are very expensive and they're covered under Part B, as in boy, not Part D, they're covered by the original Medicare Part B, but at 80%, and your 20% costs you $1,000 a month, it would be worth it for you to pay $200 a month and have those Part B expenses covered for you. Okay? So everybody's situation is different. Okay? But yes, that's how it works. Okay, that's Medigap.
Got a question.
Yes, sir.
Let's say you're on an expensive medication. Now, does this Medigap cover that?
Medigap plans only cover what is covered in your Medicare and You handbook, parts A and B. Medigap plans do not cover prescription drugs covered under Part D of Medicare. So if you go for a Medigap plan and you want drug coverage, you have to buy a separate plan for your drug coverage, which I will cover later. Okay? Hand in the back. Good question. When do you enroll in Medigap? New York state law allows you to join a Medigap plan anytime you want, as long as you're not currently in an Advantage plan. So if you're not in an Advantage plan and you want a Medigap plan, any time of the year you can do that. Yeah, you can, but you got to get out of the Advantage plan before you can go into the Medigap. And there's only certain ways you can do that. One is at the end of the year when you're allowed to renew, you just don't renew. Another way I will talk about later. Okay? So the alternative to Medigap that most people choose is called Medicare Advantage. Medicare Advantage plans came into existence under Part C of Medicare law. So they're referred to as Part C plans. But their cards don't say you have Medicare Part C. They say you have an Advantage plan. So if you hear Part C, you know they're talking Advantage plan. Okay? They're synonymous. Part C Advantage plans are different than Medigap supplement plans. They are different in that the supplement plans work automatically after Medicare. Medicare gets the bill first, pays its portion, what's left goes automatically to the supplement, and it's paid and done. Good anywhere in the country. As long as they take Medicare as primary, the Medigap supplement will be secondary. No restrictions, no limitations. The Medigap supplement plans are not receiving financial assistance from the government. They are totally independent. The Part C Advantage plans do receive financial assistance from the government. The arrangement is that the Advantage plan takes over the responsibility for paying the bill. Medicare doesn't pay the individual bills anymore for anyone who has an Advantage plan. What Medicare does is send the Advantage plan a monthly check, a monthly stipend, a standard amount of money every month for every person. Whether you're using a lot of services or not, the plan gets your monthly stipend, up around $800 a month, or $10,000 a year. It's that money that they're after, why they send you all this literature this time of the year saying, choose me. It's not because they love you. Okay? They want you to choose them because once you choose them, they will get that money from the government. And if you choose a Medicare Advantage plan, and then by mistake show your Medicare card for treatment somewhere, and the bill goes to Medicare, you will get a rejection notice. One of those we gave at the office type notices. Don't come to us for payment. Have the bill go to your Advantage plan because they have your Medicare dollars. Now that's an important concept that you must be able to absorb and understand, because the plan you choose is going to get your dollars from Medicare. If you want to use that plan with your doctors, you have to make sure your doctors accept that plan. Because if your doctors don't accept the plan, you can't go back and have your doctor bill Medicare. It won't work. You'll get that rejection notice. You have to make sure the plan you choose is accepted by the doctors and hospitals and care providers that you intend to use. That's your responsibility. Okay? And no one is going to give you that answer, except maybe your doctors. Yes, sir.
I don't know if you'll be able to answer this or not, but you're saying for about $200 a month, you can get a Medicare that you can use anywhere and it covers everything.
That's correct.
And the government's giving the Advantage plan $900 a month. You have all these different restrictions.
That's what I said. You're actually absolutely correct. But you can purchase one of these, sign up for one of these Advantage plans for as little as $0 a month. That's the difference. Some of them are offered at $0 or $25 a month because they're getting all that money from the government. This is a business, people. A big business. Don't treat it as anything else. Don't assume someone else is out there trying to do what's right for you because they're doing what's right for them all the time. You have to keep that in mind. Yes, sir.
As far as Medicare, do you have to check the doctor if they accept
No,
it?
no, there's no. They have to accept it. If they accept Medicare, the Medigap is automatic.
Oh, but they have to accept Medicare.
You have to make sure they accept Medicare as primary.
Still have to ask.
It's good to ask. Okay, so Medicare Advantage plans come in a variety. The most popular are HMOs and PPOs. HMO, Health Maintenance Organization, is the most basic type of Advantage product. They require you to have all your doctors and all the hospitals that you go to be in their network. That term network, what that means is the doctors and hospitals and medical providers have signed an agreement with that particular insurance company to accept the payment from that company. They're no longer getting paid by Medicare, they're getting paid by your company. And if they have an agreement to accept that, those are the network. That forms the network. With an HMO, a strict HMO, they don't cover you if you go outside of their network. So you can get one for $0 premium, but you accept the limitations of having to stay within their network, which may not be bad, but you have to live with that, okay? That's the limitation. Then there's something called a modified HMO, HMO-POS. What does the POS do? Point of service, what it does, if an HMO says it's also POS, it means that they will add an additional benefit to the plan, which is a travel allowance, which is an amount of money that they will cover for your health care if you choose to travel out of the network. Remember, I said choose to travel out of the network. If you're on vacation and you have an emergency, that's not a choice. Emergency coverage is on every plan. You don't use your travel benefit for emergency. The travel benefit is if you want to choose to go out of network and get care. Okay? And if it says POS, it usually will give you $3,000 a year to travel out of network should you choose to do so. With that $3,000, they typically still charge you your copay of about 30%. So you're actually only getting about $2,100, $2,200 from the plan. You're paying the other 30%. Okay, that's how they typically work. If you spend more than the $3,000 out of network, you will pay 100% of the overage. But at least you have $3,000 to use if you want to go out of network. So it's a little bit more forgiving than a strict HMO. Then there's something called a PPO, a Preferred Provider Organization. A PPO is a plan that allows you to go out of network as much as you want. The hook there is they have two different rates set up for the service, for the care that you're going to want to get. If you get that service or care in network, you will pay the lower copay rate. If you choose to go out of network, you will pay the out-of-network rate, which is typically significantly higher. But you have that freedom of choice. If the choice is important to you, and that's okay with you, that's what you can do. If you're a snowbird and you're spending 3-4 months a year somewhere out of Rochester and you want coverage and you're willing to pay a little extra for that time that you're out of Rochester, that's a good way to go. The only other way to do it would be to go back to a Medigap supplement, which is good anywhere. But then you're going to be paying that higher premium for the whole year. Okay? So, in your package, again, in that inner folder, another document to look at is this 2-pager. It's printed both sides, front and back, two pages stapled together, called the Medicare Advantage Comparison Chart that we produce here at Lifespan for Monroe County. That's a list of all the major plans that are available to choose from that are Advantage plans. Okay? Some of them are an HMO. Some of them are an HMO POS. Some of them are PPOs. You have to pay attention to that. We give you that information in our chart. It's part of the name of the plan. It's in parentheses next to the name. We also give you the Medicare Star Rating, which is Medicare's rating for the company on how they do with customer service and meeting what they say they're going to do and all of that. Medicare rates them from 1 to 5 with a star rating. You're not going to see any 5-star plans here, but you'll see 4.5s. Our ratings on that sheet are from last year, so let me update you. This year, both MVP and Excellus are 4.5-star ratings. Okay? Both MVP and Excellus are 4.5. The others are 3 or 3.5. The other thing you need to know about Advantage plans, they have their networks. Aetna and United Healthcare are very good plans, but they have their network, which is Strong Highland. If you want to use those plans at Rochester General or at Unity, they will be out of network, and you will pay out of network co-pays. Okay? That, I'm talking next year. Aetna and United Healthcare, their network is limited to the Strong Highland system. They will not cover in-network at Rochester General or Unity.
This is next year.
Both Aetna and United?
Yes, I'm talking for 2018. In 2017, there was some leeway with United. That leeway is going away for next year.
Why do they not offer it now?
It's because they didn't come to agreement on who would accept what, who's willing to pay what. Both MVP and Excelis are accepted at RGH, Unity, and Strong Highland. So if you need RGH Unity as an option in network, you have to limit your choices. If you can limit your care to Strong Highland or are willing to pay the out-of-network prices, you can use Aetna and United Healthcare. Yes, sir.
Like say Excel, you're saying in network. Is that just Monroe County, or is that any place in New York State?
They usually have like a multi-county area where it's good, but to find out where all that is, you need to contact the plan itself because it varies. I can't say specifically how many different counties it covers, but typically, if you're in an HMO, you need to get all your care local. If you're in a PPO, and you go out of the network, you're going to pay the higher rate. Some of these plans have something they call passport or reciprocity, where if you let them know ahead of time where you're going, say you're going to Florida for a month, and you tell them where in Florida you're going, they'll tell you what doctors or hospitals you can see down there that will still be considered part of the network, even though you're not local. Okay, but you have to go to the specific ones they tell you. You can't pick and choose any one you want. Okay, I need to move on. Medicare Advantage plans. The next one I want to cover is Part D prescription drug plans. Now, if you're in an Advantage plan, you're going to get your drug coverage as part of your package with the Advantage plan. So you don't add prescription drug coverage to an HMO or a PPO. Won't work. But you can add prescription drug coverage if you have the Medigap supplement, because the Medigap supplement does not include drug coverage. You can also have prescription drug coverage if you just have original Medicare A or B or both and have no other insurance but want drug coverage. You can add it. Okay? Now, another document in that inner folder on the left is a page that explains Medicare D on one side and gives you all the plans, Part D plans to choose from on the back. Okay? So, these are the plans to choose from. But this chart will give you the name, and it'll give you the monthly premium. It'll tell you if it has a deductible associated with it. And a drug deductible is different from a Part A or a Part B deductible. This is a separate deductible for drugs. But this is not enough information for you to use to select a plan. Because you cannot just assume that every one of these plans will cover the same drugs at the same prices. They don't. Okay? Every plan has what they call a formulary. A formulary is a list of the drugs they cover and the prices they charge for their copays. The way to find out which is the best plan for you is to use a computer program. And if you don't have a computer, you can call 1-800-MEDICARE and they will do it for you. Or you can call us locally at Lifespan. We have computers. You give us your list of prescription drugs and we can go on the internet and we can enter your list of drugs and have the program tell us which is the best one for your specific drugs. If you do have a computer, you go on to this website, www.medicare.gov. You come down here to where it says Find Health and Drug Plans. And then you click on that and you're taken into the program. The first thing you need to do is tell the program what your zip code is, because this program is valid for all across the country. And for the program to limit itself to the drug plans available where you live, it has to know your zip code. You give it your zip code, and then it knows that those plans that I gave you are the ones that are available to you. Then you give it your specific drug needs. One by one, you enter your drugs. Hit enter. When you're done, you tell the program you're done, and the program will look at all the plans available to you, look at all the premiums they charge, look at all the deductibles associated, look at all the copays for your specific drugs, and it will give you all that information in a printout as to what each one of them will cost you for your drug. That's how you pick a plan. Okay? So I'm going to leave it at that. I want to cover EPIC. EPIC is a New York State program for those who are 65 years or older, because you can have Medicare under age 65 if you're disabled. But EPIC only covers those who are over 65. It is intended to provide assistance with the cost of your prescription drugs. What EPIC does is they become a secondary payer on the drug cost. Just like your Medigap supplement is a secondary payer on Medicare, EPIC is a secondary payer on your drug costs. It is on top of whatever other coverage you have as primary for your drug coverage. That could be your Advantage plan or a standalone prescription plan. Either one would be primary. EPIC would work with it as secondary. And EPIC can lower the copays that your insurance is charging. Okay? To qualify for EPIC, you need, as a single person, to earn less than $75,000 a year. Or as a married couple, joint income has to be below $100,000 a year. Those numbers increased about 5 years ago. Before that, it was half of that. And then they raised it. So many people who looked 5 years ago and didn't qualify should relook. You may now qualify. EPIC is extremely valuable because it provides a little bit more than just help with the drug coverage. If your income is below a certain amount, EPIC could contribute up to $39 to the cost, your monthly premium of your prescription drugs plan, on top of lowering the cost of your specific copays. And even if you do not use it at all to help with your prescription drugs, say you don't take any prescription drugs, even if you don't use it for prescription drugs, by signing up for EPIC, EPIC is considered New York State's state pharmaceutical assistance program. SPAP. And under federal law, if you join your state's SPAP, the federal government will give you the right to change your drug coverage in the middle of a year. One time, this is what I was referring to earlier, one time each year, but it does not have to be during the open enrollment period. It could be any time during the year. Now, if you are in an Advantage plan and you come down with some terrible medical condition like your kidneys fail and you need to go on dialysis, if you stay, you could stay on your Advantage plan, but every trip to dialysis is going to hit you up for $50 or more as a copay. And you're going to be spending a minimum of 3 copays a week, maybe more. And over a month's time, you'll have $300, $400, $500 in copays just for dialysis. You're going to want to get out of that Advantage plan as fast as you possibly can. If you have Epic and your Advantage plan has your drug coverage, Epic allows you to change your drug coverage. So what you do is you sign up using Epic for a different drug plan that just covers drugs. And when that sign up is acknowledged instantaneously on the internet, you get a confirmation. You then can use that as the basis for not being in an Advantage plan anymore and go and sign up for a Medigap supplement. You're following me? I see you shaking your head. I've done it for people. It works. This is a get out of jail free card. So if you don't have Epic, I strongly advise you to pick up an application here. The last thing I'm going to say, the last slide I'm going to cover, is for low income. Hopefully none of you here have to worry about that, but if you're a single person with income under $1,400 a month or a married couple with income under $1,900 a month, there may be plans, federal and state government plans to assist you with your costs. One is called Medicare Savings, and that's through the county. It will help pay for your Part B Medicare premium. And the other is called Extra Help. It's through the federal government. You apply to the Social Security Administration. That's for help with paying prescription drugs. If you or someone you know you feel might qualify, you can always have them call us at Lifespan. We will consult with them. We will provide them the applications and help them apply. We don't get to make the decision, but we can help them apply. That's the extent of the presentation today. Thank you for coming. Any other questions? Yes, ma'am.
Is there a limit how much you can make if you join Epic?
Yes. As a single person, $75,000 a year. As a married couple, $100,000 a year. Anything under, you can qualify. That's correct. You only apply to Epic once. You don't apply every year. As soon as you turn 65, you can apply for Epic. Yeah, they get a lot of applications for people who are going to turn 65 in the next year. They don't want that. So they ask that you wait till you're 65. I mean, a week or two before probably is okay, but not much more than that. And it only takes 2 weeks for them to process your application. Yes, ma'am. They probably don't do much advertising. Well, all options are listed in the back of this book. Advantage plans and drug plans. They're all the options are listed in this book. General question?
No, specific.
Specific to?
Medigap.
Okay.
In a Medigap, there is an F plan,
Yes.
and there was somebody was telling me that the government will close that plan because it's too good.
Okay. For anyone who is already eligible for Medicare, you will always have the F plan as an option. For those who turn Medicare eligible after the year 2020, they won't have that option anymore. The reason is, with the F plan, as I mentioned before, all your copays are covered. Everything. And the government is afraid, I'm not saying it's true, but the government is concerned that it encourages you to get treatments for things that you maybe really don't need. And so they're trying to,
So anybody who is in any advantage plan or anything, they can change for, as long as they live, they can change to F plan, in that sense, that's what you're.
yes, okay? Questions specific to any one of the individual plans. Scott Ritchie from Excelis, Maritza from Aetna, and Paul Richardson from MVP. They can answer questions specific to their plan's coverage. Okay? Thank you. Raise your hand if you have a question, and we'll get you an answer.
Okay, not in a derogatory way towards Aetna.
Good start.
I guess I came to this meeting today thinking that Aetna would still cover RGH in Unity, and that United was completely off the charts. But what I heard here earlier sort of told me that both United and Aetna were out of that, and it would be out of network if you chose Aetna.
Right, so for RGH and Unity, we are out of network. However, depending on the plan, we have enhanced the out-of-network benefits to match those in network. And I can't go into specifics, but then, yes, so,
What do you mean you can't go into specifics?
well, if you want a one-on-one, I can go over the plan. This is not the forum, but we have enhanced out-of-network to a copay services and traditionally to a co-insurance on a PPO.
And about what percentage would that be?
It's actually a flat copay, which is nice. It's not a co-insurance. So it's a great option for those who are looking to do elective services in the hospital system.
But you don't cover.
Rochester Regional Health System and Unity are considered out of network. However, both of our PPO plans have out of network set copays for certain services to allow those folks to use that hospital system. Yes, ma'am. Emergency, you're covered just as is. So you're covered in any hospital under emergencies.
You have a question here?
Yes, sir.
As far as Aetna covered an emergency, I go into emergency, and after that they declare I am over with the emergency, but you need a surgery. Then I have to transfer to another hospital. Is that
Yeah,
it?
it has to be deemed by the doctor's notes,
But then I
certified
have to
to
move,
stay in that
move
particular
from that
hospital.
hospital to
If
another
that's the
one.
situation, yes.
I have a question related to that.
My question actually is because I'm also involved in ambulance work, but we were told, I've been to several presentations, we were told that just as he just described, you arrive at general, for some reason your doctor sends you to general and you need something else. They are going to now call an ambulance and transfer you to Strong. I'm wondering which companies are going to pay for 2 ambulance trips. Are you going to pay for both trips? The one that got you there and the one that takes you to Strong? I don't think so.
Yeah, that would be based on the situation. Yeah, I can't answer.
Yeah,
to
but I
that,
mean,
but,
that's
yeah.
basically 2 ambulance trips for 1 illness, and I'm pretty sure nobody's going to want to pay for that, but I could be wrong, but we're concerned as an ambulance provider, to tell you the truth.
Hello. Do any of your companies have a veterans dental plan?
Down the line.
MVP offers a dental option for all members, regardless of whether you're a veteran or not. It's part of our marketplace program, but it has access to anybody that's a New York State resident. So it's not specific to veterans, but it is something that everybody has an option to add to their existing plan. It's not really a rider. A rider is something that's attached to a plan. This is a separate dental benefit that's completely separate from any of our Medicare Advantage programs, but we do offer dental through MVP.
So with Aetna, both of our PPO plans have a reimbursement allowance. So depending on which plan you're interested in, you will receive an allowance, yearly allowance for dental, vision, or hearing.
That's the Advantage or the supplement?
Both of our plans we offer here in Monroe County are PPO plans. So it would be Medicare Advantage, yes, sir.
And Excelis has two Advantage plans that do offer preventative dental on their plans. That would be included in the Advantage plan.
And all the telephone numbers and everything for you guys are right in here? Okay. Thank you.
How about the hearing aid? I know Excelis is offering that, but it's like a mail order.
You would just
The
have
hearing aid plans, they really don't cover very much. And who wants to get a hearing aid on a mail order?
you would actually just have to use a true hearing provider. There's a phone number that you would call to see and find a true hearing provider in this area, and you could schedule an appointment with them, but not necessarily as a mail order, no.
Thank you.
MVP offers the same true hearing benefit as well, so that comes with all of our products. Excelis and MVP both have the same benefits, but he's correct. You don't have to get them mail ordered. You get to speak to an audiologist. They fit you. The hearing aids, the batteries are included, fittings, etc.
Yeah, and with that NUP plan, it's just a reimbursement. You can go to any vendor. You can, shop anywhere, and then they would reimburse you up to $500 on the Elite plan.
With Excelis or MVP, is New York State in network, or is it just Monroe County?
As far as MVP is concerned, we used to be Preferred Care. Many of you were maybe Kodak retirees and remember the Preferred Care days. So MVP is based out of Monroe County, but also Schenectady. So our in-network runs from Buffalo all the way up into Vermont. That basically the majority of the state is in-network. That's the North Country, that's into Elmira. The only exception to that would be the New York City area and Long Island areas. We don't have really much presence in that area, but the upstate, Western New York, Central New York is in-network with MVP, including Buffalo.
Thank you, Paul. And as far as Excelis is, the in-network would be the 6 county, Livingston, Monroe, Ontario, Seneca, Wayne, and Yates counties would be considered in-network. But we do, again, offer urgent care and emergency care, which is covered worldwide. And we do have 2 plans that do offer a point of service where you do have some out-of-network benefits. And again, we can discuss that further if you'd like. And
Are eyeglasses and eye exams covered by either of them?
For Aetna, your hearing routine and eye routine exam is covered at no cost. For both of our plans, we do have a reimbursement allowance, as I mentioned, and it's a dollar amount that's reimbursed to you using any vendor.
Same holds true with MVP. Just so you guys are all aware, most of the plans here are going to have 2 or 3 different plan choices. So typically or historically, the higher the premium, the richer the benefits. It's one of those things where you want to do your calculations to figure out, should I pay more per month to get a little bit richer benefits with, dental prevention and some of those things? Or am I better off paying the lower premium and coming out of pocket for those services? That's where all 3 of us, I think, are very good at sitting down with people and explaining each plan individually and helping you to determine what's the most value to you. That's the whole idea of open enrollment, is doing your comparisons to figure out, what do I really need value-wise?
Where does this take place?
We do, all of us, I do group meetings and I do individual one-on-one consultations as well. I think that's the same with all of us. We have meetings all over the county. This is go time for health insurance, so there's quite a few of them going on right now.
Have I been missing something? Some announcements about the dates?
The dates are all over the place, you guys.
Yeah,
you
I
know
mean,
everything.
if you need some options in your area, I'm not sure if you're here in Monroe County, Irondequoit, but every Thursday we're out west at the DoubleTree. I mean, I can give you more specifics.
Correct.
Yeah, I would agree. We did do an advertisement in the Democrat Chronicle this past Sunday, but again, I could certainly give you dates of seminars in this area, just like Paul and Maritza here. Yep.
If I could just remind everyone to please wait to ask your question until we're able to hand you a microphone so that everyone can hear the questions that you're asking. Do we have any more people who would like to pose a question?
Could I make an appointment today with you on a one-on-one?
Yep, I can certainly get you in touch with the representative. Yes, we can do that, yes.
All right, thank you.
You're welcome.
Arlie, this gentleman has a question.
I've seen a really nice spreadsheet from Excelis, came in the mail, showing the comparisons of the plans. Do the other two plans have those, and are they available, or you need to make an appointment to set up to meet to get those, or will they be?
They're available.
I have mine available as well.
Okay, thanks.
like
And
one?
Lifespan's the spreadsheets that Lifespan uses are very good. Those are, as far as a comparison sheet is concerned, they do an excellent job doing these. Some of our programs may have a little more detail just for lack of space on the Lifespan document, but you definitely can get those.
yeah, okay, I was going to say that the lifespan stuff is really, really helpful, and I tried to put those together myself in the past few years. Yeah,
Completely
you don't wanna
unnecessary.
do that.
Save yourself the effort. Sometimes you have to read between the lines on these spreadsheets. There's things that you really, it's a good idea to come to the presentations, hear what each plan has to say, because you can go dollars and cents and talk through numbers, but sometimes there's subtleties that you really need to understand to make an appropriate decision.
Other questions? No? Well, thank you very much. I know that all of our speakers do have cards if any of you are interested in making appointments with them at another time. Thank you very much for coming today and for taking the time to attend our forum. Thank you.